I'm Barbara, and I've been a patient here since late last year. Yeah.
What were the issues though that made you
Oh,
look for pain management?
long-term back and neck pain that I've been treated for years with steroid injections in California. Wasn't working, so came here, of course, still in pain, and Dr. Ray, I believe is his name. He just gave me the list of exercises and then pain medication, and I like the staff, I like the office, I like the professionalism, and she can drive me here, because I don't drive the freeways yet.
Have you had any procedures done or surgeries since you've been with your pain?
No.
So just the medications and the home exercise?
Yes.
Great. Do you have a goal of getting away from the medication at some point, or are you kind of happy with what you're doing?
I'm good at what I'm doing, because from years ago when I started, I'm taking half as much medication, and so I'm happy with that. That works. Eventually, yeah, it would be great to be without, but I just don't think that's going to be possible, and I don't want surgery. I don't want any of that.
Yeah, sure. So when you came to Premier Pain, looking back, do you recall like what your pain level was back then, like on a 1 to 10 scale?
3 and 4.
Okay. And where are you at on a normal day now?
2 to 3.
Okay.
You were a little higher than a
You
3
think
to 4.
so?
I think you're being generous. Sorry to kind of
No. Okay.
cut in here. I'm Taleena. I'm Barbara's daughter. I help her a lot with things. We're from California. I recently moved her over the last year here to Ohio to be near us and help with her care. I have also experienced chronic pain and pain management doctors, so I was happy to go along with her and help guide her establishing new doctors, new medications, new protocols, new health things. We're adding more into her regimen, from starting with Dr. Ray and then now Danielle, with the exercises and stuff. So I try to help encourage her with that. But I can say during the move and before you got settled here, I would say your pain was more like
That's
a 6
true.
or a 7. So you were being nice.
Yeah.
She was hurting more.
And plus, I just started at the Charles, becoming a member at the Charles Latham Senior Center, and doing volunteer work there, and they offer a variety of exercise classes, which I'm going to be signing up for.
Yeah, good.
So I'm ready to do that on a regular basis.
As her daughter, I find it very important that you guys are encouraging things other than medication. To me, that's very important. I like to see that with her.
Yeah.
She takes regular flexibility and Pilates classes, and
I'm always
does a
getting
lot
on
of work with not using medication.
Yeah.
The
Right.
stretchings, the exercises, and that seemed the way this clinic wanted to go also, so I'm getting there.
which is why I still take her here.
Yeah.
Honestly, if we've
Right.
been pushing other things, she wouldn't still be here. So as a daughter, looking out for my mom's health, I am happy with her being here and with everybody that we've worked with.
Yeah. So do you see Danielle typically when you come in?
This is the third time since she's been my provider.
Yeah.
Prior to that, it was Dr. Ray.
Sure.
And Danielle's a sweetheart.
Yeah. Good.
Just from watching you over the years, and from what I've experienced too, stress comes along with pain. And when you're going to a pain management office like here, the staff has been so kind and so friendly. They're helpful with everything from scheduling to insurance to billing. Everybody from front to back has been so kind and easy to work with. Taking that level of stress off of patients, being at a nice, kind area, I think is almost step 1 to managing your pain. You can't manage your pain if you're not in a healthy environment. And again, I'm speaking for her, but for me, I feel like she's in a healthy environment, so I'll keep bringing her.